Scientific studies show that onions can be useful for 8 serious diseases. However, it will become a cure only with the right preparation, dosage, and duration of use. In this video, we will discuss how to properly consume onions to lower blood sugar and blood density, blood pressure, bad and total cholesterol levels, and to reduce the risk of cancer and heart disease. Let's also look at how onions can help improve bone density, fight osteoporosis, improve menstrual cycles, and for colds. We'll find out if onions can be consumed by pregnant and nursing moms, as well as people with heartburn, and find out what is better, onion or garlic, and what kind of onion is healthier, red, yellow, or white. By the end of the video, we will bring out the 10 rules of onion consumption, and you will get a complete guide on how to properly consume onions to cure diseases and avoid harm, as improper preparation can cause harm. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. And we are going to start with you by consuming onions for cancer prevention. You heard right. Eating onions can actually greatly reduce cancer risks, as shown by the results of 8 different studies that were conducted over a total of about 13 years. These studies compared the incidence or mortality from cancer in people who ate no or very little onions compared to people who ate onions 3 times a day. The cancer mortality rate for people who ate onions not at all or ate them no more than once or twice a week was taken as 100%, and the mortality rate for the rest of the people was expressed as a percentage of that 100%. Frequent onion consumption reduced the risk of esophageal cancer by 88%, the risk of colon cancer by 56%, breast cancer by 25%, ovarian cancer by 73%, prostate cancer by 71%, kidney cancer by 38%, and mouth and nasopharynx cancer by 84%. These are absolutely incredible things, and if studies showed that any loaf could reduce cancer risks to the same degree, it would simply be swept off pharmacy shelves for any money. And onions, as a preventative, grow practically underfoot and cost pennies, and they can't be adulterated. And on average, in these studies, people consumed very little onion, about 80 grams per day on average. That's half of a perfectly small onion. With equally phenomenal effectiveness, onions help reduce the risk of dying from heart disease. A meta-analysis of 95 different studies from around the world, covering a total of over 4.5 million people, found that daily and regular consumption of onions, compared to people who don't consume onions, helps reduce the risk of coronary heart disease, which is the leading cause of death in humans, by 25%. The risk of dying from any kind of stroke by 11%, and the risk of dying from all causes that cause death by 15%. This is a very, very large number, and accordingly, we can conclude number 1. The daily consumption of 80-100 grams of onions of any cooking method can significantly reduce the risks of death in general, and from cancer and heart disease in particular. However, when we go directly to the treatment of diseases, then here the method of cooking onions plays a key role, because it can not only increase the effectiveness of onions as a medicine, but even turn it into a health antagonist. Onions have a huge amount of bioactive substances that can actually be a medicine and that are medicinal. That is why onions help treat diseases that are the result of metabolic disorders. And these are high blood pressure, hypertension, dyslipidemia, impaired cholesterol levels, elevated blood sugar levels, and diabetes, as well as obesity. Let's start with the sweetest part, blood sugar levels. Onions contain 2 groups of substances that help both lower blood sugar levels directly and increase insulin production, which in turn also lowers sugar levels. These are flavonoids such as quercetin. Within just a few weeks, eating onions can lower blood sugar levels on an empty stomach, that is, in the morning upon waking up, in patients with type 2 diabetes and in patients with type 1 diabetes. That is, people who do not produce insulin at all. Of course, eating onions had less effect on lowering blood sugar levels than insulin, but almost as much as using any kind of diabetes medication. That said, onions also had a large number of other beneficial effects. What's more, onions not only helped lower blood sugar levels in diabetics, they also helped people who were being treated for cancer. Because doxorubicin, a cancer drug used during chemotherapy, can interfere with the body's normal sensitivity to insulin. So, eating onions helps avoid this disruption of insulin sensitivity. Researchers divided cancer patients who were treated with chemotherapy into two groups. One group consumed 100 to 160 grams of onions per day, while the other group consumed 30 to 40 grams of onions. The group that consumed more onions had a greater drop in blood sugar levels. The more onions people consumed, the greater the drop in blood sugar levels. In addition to blood glucose, eating onions also significantly reduced inflammation levels in the body, which is critical for healing and reducing the damage that chemotherapy causes. In this study, people ate raw onions. If you're already getting teary-eyed at the thought of eating 160 grams of onions, don't worry. At the end of this video, I'll give you 2 recipes on how to turn onions into a treat, make them tear-free, and significantly increase their ability to lower blood cholesterol. And you and I are moving on to onions' ability to lower bad and total cholesterol. For lowering cholesterol, again, raw onions work. A pooled analysis of 10 different studies showed that regular consumption of raw onions can lower total and bad cholesterol and raise good cholesterol. And another meta-analysis showed that both onions themselves and various onion or onion peel supplements can lower blood cholesterol. But in order to reduce cholesterol with onions themselves, which we are now actually interested in, it is necessary to consume at least 100 milliliters a day of juice from raw onions. Friends, do not be frightened. It is not necessary to drink it poisonous, freshly squeezed, weeping and cursing everything in the world. Onions can be strained, you can juice onions for a few days, store it in the fridge and consume it, and it really won't be so poisonous then. Or there are ways to significantly reduce its venomousness, and I'll tell you about those as well. If you really don't like onions, even just 50 milliliters of onion juice can work to lower your cholesterol. But as another study has shown, the more onion juice you consume, the greater the cholesterol reduction. So in our recommendations, we will focus on the fact that 100 milliliters of juice is a perfectly adequate and optimal amount. Of course, blood cholesterol levels need to be lowered not only with onion juice. There are no magic pills. You need to make a lot of different changes in your diet, both in the choice of products and in their quantity and combinations. So which onions should we choose? The most common are yellow, or inside it's white, and red onions. Which type of onion is the healthiest? Of course, red, because it has more nutrients. The same ones that give them their red color. They are called anthocyanins and belong to the group of polyphenols, which I talk about every time in my programs as therapeutic substances. As the study showed, adding raw or blanched onions significantly lowered blood cholesterol levels. But it was the red onion that helped lower blood cholesterol levels more than white onions or garlic. For onions to work, they need to be blanched for no more than 90 seconds. That's just a minute and a half, because longer heat treatments completely destroy all the beneficial cholesterol-lowering properties of onions. This is a very important note for you, because even such a short blanching, and after it the onion should be immediately as soon as possible cooled in the refrigerator, allows you to remove the sharpness of the onion and excessive odor, and thus consume onions without problems and suffering. We have seen that red onions work better than garlic, and we have made conclusion number 2. Red onions should be used. Let's define the most important parameter in which onions are really better than garlic. Consumption of onions and lemon juice does indeed lower cholesterol, but it also causes significant irritation to the mucosa of both the stomach and intestines in a great many people. The problem with garlic is that for all the abundance of beneficial substances in it, its therapeutic dose is very close to the toxic dose, which can cause both minor poisoning and, most often, significant irritation of the intestines. Consumption of garlic, even in small amounts, can cause destruction of tiny villi, which dot our intestines, and through which all useful substances are digested. This destruction leads to the fact that many people, when consuming even not very large quantities of garlic, I'm talking about 3 or 4 garlic cloves a day, begin to have stomach aches. These people simply cannot use garlic to lower their cholesterol. This harmful property of garlic, unfortunately, prevents us from eating it in the same quantities that we can eat onions. This is why eating garlic is significantly less likely to reduce cancer risks. Remember our first reasoning? Well, look at how much less cancer risks are reduced in people who regularly eat 2 to 3 cloves of garlic every day. And most people can eat onions without fear and in very large quantities. Remember, cancer patients on chemotherapy used to eat up to 160 grams of raw onions a day, and everything was fine. And everything was fine because, unlike garlic, onions only improve intestinal function. That is, they help the intestines to perform their functions more efficiently. Accordingly, for all the promotion of this ancient garlic and lemon juice recipe, I would still recommend that you switch to onions. All studies show that red onions lower cholesterol more significantly than white onions and more significantly than garlic. But I'll remind you again, only if you consume it raw or processed in the 2 ways I'll talk about at the end, or blanch it for no more than 90 seconds. Another study that was done on rats, but we can safely extrapolate its results to humans, showed that if onions were subjected to a long enough heat treatment, i.e., more than 5 or 10 minutes, they lost all their ability to lower bad and raise good cholesterol. In addition to this, it also acquired one very unpleasant ability, which we will talk about in a moment. The fact is that most people who already have problems with blood sugar or cholesterol often have problems with what's called blood thickening. So onions can be used to thin the blood, but you have to keep in mind that onions can very easily go from being a great medicine to a product that brings you harm. Yes, onions can indeed become a bomb planted under the foundation of your good health. However, let's start by determining how many onions you should eat in order to thin your blood. It's quite small amounts, 50 to 70 grams of raw onions in various studies. However, another study on rats showed that only raw onions or properly cooked onions can reduce blood density. The ability to lower blood density and reduce the risk of thrombosis is called the anti-aggregant effect. A scientific study has shown that if heat treated for no more than 3 minutes followed by rapid cooling, its anti-aggregant effect is virtually unaffected. That is, onions processed for 3 minutes have almost the same blood-thinning effect as raw onions. But onions cooked for 20 minutes worked in exactly the opposite way. They only increased blood density and increased the ability of blood cells to aggregate, that is, to stick together and form clots. Onions cooked for about 20 minutes or more became dangerous for those people who have problems with blood density. And 20 minutes of cooking time is pretty much the normal time we cook onions, such as in soup or with stewed vegetables. With this example, you see, friends, how science helps us avoid traps that humans or lab rats have already stepped into. Just as with cholesterol, a whole host of dietary changes must be made to successfully maintain normal blood density. One more metabolic disease that onion consumption helps fight is hypertension, an increase in blood pressure. In parallel, we will also deal with how long you need to consume onions in order to achieve a beneficial effect. The use of onions can really lower blood pressure, both upper, systolic, and lower, diastolic, and at the same time reduce weight and waist circumference. But in order for onions to lower blood pressure, it is necessary to eat them raw, because those substances that lower blood pressure are destroyed by any heat treatment. And you and I can make the following 3 conclusions. Conclusion number 3 is that in order to make onions a cure for diseases associated with metabolic disorders, and this is an increase in blood pressure, cholesterol and blood glucose levels, diabetes and obesity, and use onions to thin the blood, It should be consumed in an amount of 50 to 120 grams per day, or drink onion juice, 100 milliliters per day. The more you consume onions, the stronger its beneficial healing effect. Conclusion number 4 is that heating onions, boiling, microwaving, or frying for 3 minutes followed by rapid cooling does not reduce their ability to thin the blood, but it does deprive onions of their ability to lower blood pressure. Onions blanched for 1.5 minutes are almost as good at reducing bad and total cholesterol as fresh onions. However, onions cooked for 20 minutes or more don't just lose all their medicinal qualities, they, on the contrary, thicken the blood. Therefore, for maximum benefit, onions should be eaten raw, either the onion itself or the juice, or processed in 2 ways, which I will talk about later, or heat-treated for a maximum of 1.5 or 3 minutes, followed by a quick cooling. Do not leave onions in a pot or pan. Conclusion number 5 is that to get a beneficial effect, you need to use onions for at least 12 weeks, 3 months at a time, or better yet, for the rest of your life. We are done with metabolic diseases and move on to the effect of onions on bone density. With age, most people, and in women much more strongly than in men, significantly reduces bone density. This is called osteoporosis. Not only does osteoporosis increase the risks of fractures, but in the elderly these risks can be fatal, especially the risk of a femoral neck fracture, after which very many elderly people simply can no longer stand up. Osteoporosis, after the age of 60-70, also greatly affects posture. If the bones become porous, the spine is simply unable to hold posture, and the person bends, acquiring the senile posture that we are so familiar with. Therefore, osteoporosis must be avoided by any means necessary. One of the most important and foremost of these is ensuring that you have enough calcium in your diet. Eating onions regularly, in addition to this knowledge, will help you maintain your bones and youthful posture into your old age. In this study, scientists investigated how the frequency of onion consumption affects osteoporosis and fractures. It turned out that those women who ate onions daily, compared to those who ate them once a week or once a month, had 5% more bone density. This led to a 20% lower incidence of femoral neck fracture. The most dangerous fracture, as I told you, they had 20% less bone density. 20% is a lot. Another study showed that you only need to consume about 100 grams of raw onions to do this. Those who did this began to increase bone mineral density and decrease bone mass loss in just 8 weeks. And onions can be beneficial to women in one very unexpected way. They can stabilize and improve the frequency and regularity of menstruation. This study involved women with polycystic ovary syndrome. This is a very unpleasant and incurable disease, and they all suffered from various menstrual irregularities. Some had irregular menstruation, some too heavy, some too weak. They consumed the same 100 milliliters of the same non-thermally processed onions, and their menstrual regularity improved significantly within 15 days. The results for the scientists were absolutely incredible. Almost a mirror image of the women who consumed onion juice and who did not, in terms of menstrual frequency, strength, and so on. These unfortunate 100 milliliters of onion juice normalized various parameters of the menstrual cycle in 60–75% of women. That's an incredible result. And that, friends, is our conclusion number 6. Regular consumption of 100 milliliters of onion juice increases bone density, reduces bone mass loss, and helps normalize the menstrual cycle. And you and I are moving on to the last and most obvious way to use onions, the treatment of colds. To our deep regret, the same substance that cures colds is the same substance that is a tear agent. It's called syn-propane thio-S-oxide. It is the one that has that stinking effect and antibacterial effect. It really worked in people who had the flu and COVID. This inhalation with onions significantly reduced symptoms and no side effects were found. Scientists noted that the earlier the patients started treatment, the more therapeutic effect the onion had. How to inhale onions correctly. Cut the bulb, deeply inhale through the nose, and hold your breath for 1 to 2 seconds. Then exhale through the mouth. The duration of the inhalation is 1 to 7 minutes, depending on how you like it and how much you can tolerate. It is very important to constantly cut a thin layer so that the onion is most destructive to bacteria. This cut layer can also be eaten. This method allows you to kill bacteria and viruses right in the nasopharynx. In addition, you can also eat raw onions or drink onion juice or any vegetable juice with raw onions. It is very important to drink the juice freshly squeezed because syn-propane thious oxide is very volatile. It quickly volatilizes and the juice ceases to have antibacterial and antiviral effect. Garlic, friends, by the way, also works against colds and is just as good as onions. I made a separate video on how to treat and prevent colds with garlic. Those people who do not have an acute reaction to garlic, which I described above, can combine onions and garlic to avoid getting sick or to treat colds. Now, friends, let's dispel 2 myths. One is that onions are so powerful at killing bacteria and viruses that you can get rid of them just by spreading them everywhere in your apartment. This doesn't work at all in 2 ways. First, the concentration of the active ingredient will be extremely low in the entire apartment, although you will smell the onion. And the second, as you remember, onions need to be cut constantly because syn-propane thious oxide loses its activity very quickly. So onions spread all over the apartment will definitely not work. Just like the onions won't work in a completely unworkable recipe about sticking or placing a cut onion under a sock to the foot, which supposedly removes toxins from the body. All this, friends, is an absolute 100% fake, which is in no way scientifically confirmed and cannot be scientifically confirmed because such methods do not work. And you and I make conclusion number 7. An effective way to treat colds is not to put onions in your socks at night, but inhalation with onions. That is, breathing over a fresh onion, constantly cutting it, or eating freshly cut onions without vinegar. It's very important. I'm going to tell you why. Or consuming onion juice, but both onions and onion juice must be unheat treated. Otherwise, the antibacterial syn-propane thious oxide escapes. And let's end with a discussion of practical ways you can eat 100 or 160 grams of onions, or drink half a cup, 100 milliliters of onion juice, and still not stink at weeding. And by the way, in research, I found a scientific way to weep less when you cut onions. I actually use wide goggles that practically prevent the active ingredients of the onions from getting in my eyes, and thus I don't cry. But it turns out that if you chill the onions well in the fridge before slicing, you can quickly, before they get hot, slice them and thus cry less too. The second option is to use onions with vinegar. The vinegar can be wine vinegar, balsamic vinegar, or apple vinegar, or even regular alcohol vinegar. It doesn't really matter. The vinegar really takes away the odor of the onions, takes away their sharpness, and so you can eat onions marinated in vinegar for literally 10-15 minutes. You can eat this onion as much as you want, the same 160 grams if necessary. In doing so, the onion does not lose any of its activity at all, except for its antibacterial activity. That's why I recommended in the part where we talked about onions as an antibacterial cold remedy to eat them uncooked and without vinegar. Vinegar, on top of that, can also lower bad cholesterol itself. With this in mind, we can conclude with you number 8, that pickling onions in wine, apple, or even alcohol vinegar helps to remove unpleasant odor and contributes to an additional reduction in blood cholesterol levels. You can pickle onions for 10-15 minutes, or you can slice onions for a few days and pickle them in vinegar and then gradually eat them, understandably keeping them in the refrigerator. Another way is to ferment the onions themselves or even onion juice, because onion juice can be used to make kvass. Onions have as much sugar as an apple, sometimes more in sweet onion varieties. As a scientific study has shown, souring onions, called fermentation, only increases their ability to lower bad cholesterol. Unfortunately, this study was not aimed at lowering blood sugar or blood pressure, but I'm more than confident that souring onions will be beneficial for that as well. And we make with you conclusion number 9 that fermentation, i.e., souring of onions, enhances its activity to reduce blood cholesterol at least. You can easily find recipes for souring cooked onion kvass on the internet. I won't dwell on that. One last thing, friends, harms and benefits, which is amazing for such a potent healing remedy. Onions really do have the absolute minimum of side effects. The fantasy that onions should not be eaten by pregnant moms is not scientifically proven at all, but it is scientifically proven that some nursing moms should give up onions if their baby can't stand the smell of onions, which he gets from milk. If, God forbid, your baby has colic or he sleeps restlessly or does not eat very willingly, then try to remove onions, and by the way, many other products can be removed in turn, just picking up what can harm the baby. In all likelihood, you'll end up with something that actually interferes with the baby's life. Onions, as 2 entire scientific studies have shown, can actually be a product that disrupts a baby's appetite, sleep, and causes gas and colic. And the last one is the effect of onions on heartburn, scientifically known as esophagitis. They divided people into 2 groups and fed them raw onions. It turned out that in people who didn't have heartburn, onions didn't cause heartburn. But in those people who didn't usually get heartburn from onions alone, they significantly increased it and made it more frequent. So, friends, our 10th and final conclusion is that nursing moms and people with heartburn, reflux, should use onions cautiously, according to the state of health or feelings of their baby. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.